Hi, everyone. My name is Anna Costina, and I am on the Asset Board of Trustees. And I'm here with Trey King, who is the chair of the Standards and Practices Committee. And we got together today to chat a little bit about the remote monitoring position statement. Thank you so much for joining me, Trey.
Thanks, Anna.
So I think this is something that a lot of places are either thinking about doing or perhaps in the middle of it. And um, some of these guidelines that we're going to chat about today, or perhaps just the conversation that we're going to have today will be extremely helpful. So I want to start with the basic question of what is the purpose of this position statement?
Yeah, so the purpose of this statement is to provide some guidance to facilities like hospitals who are trying to develop a continuous EEG monitoring program, and they want to utilize remote service providers, or what we often call RSPs, in order to monitor patients in the epilepsy monitoring unit or in the intensive care unit. This document can also be used by the RSPs themselves to help them develop their programs to make sure they provide everything that hospitals need. And so basically what it does is designed to help develop these partnerships between the two entities.
Interesting. So with that in mind, what would be some of the key responsibilities of these remote technologists?
Yeah, so their primary responsibility is to identify EEG activity and related events that need what we might call a rapid response or treatment, like seizures, strokes, and many other events that can often be seen only on an EEG before they're seen on any other type of procedure. Reporting of critical and even non-critical values to the appropriate provider. Basically, we are the eyes and ears of our neurologist. It's also our responsibility to maintain quality EEG recordings. We do this by identifying and troubleshooting physiological and non-physiological artifacts. And that can be very difficult off-site, but it is still a responsibility even for remote technologists as well. And then you're going to definitely need a good understanding of technology and software. And that needs to be emphasized, how to troubleshoot different things like that. So that can be kind of an additional layer of complexity.
I do know that technologists throughout the world take great pride in what they do. So this will definitely be something that will be at the forefront of everything that has to do with patient care. Um, Speaking of patients, how do these guidelines contribute to patient care and their safety, which is obviously our number one priority?
Yeah, definitely. So one of the things that an RSP can help a hospital with is to make sure that they are in a proper tech to patient ratio in monitoring. So that can be addressed, and RSPs can kind of pick up during those times where you don't have enough staff to adequately monitor patients in a safe way. Another thing that this contributes to, and we can name numerous examples of this. One is that, for instance, a patient that has subclinical seizures, which in the past we called silent seizures, and these silent seizures can't be detected by anything other than the EEG. And in these types of situations, they can cause what we call secondary injuries. In certain patient populations, and that's something to be very concerned about. Remote monitoring, uh, these specialists, these RSPs, they can help you do that. And the idea here is that the faster you're able to treat these patients, the better their outcome would be, rather than sitting there without being seen in these conditions. And it also contributes to guiding communication of critical values and the response taken.
Absolutely, that's exactly it. So let's say we all have this dream. We all want to do this. We want to offer that wonderful ratio. Um, what are some of the steps that need to be taken before implementing a remote monitoring service? We all know how difficult something like this could be.
Yeah, there's definitely some things you need to think through entering into these partnerships, especially as you look for the right RSP for your facility. One of those that should be at the top of your list is to make sure that they have qualified and trained staff. This is a very advanced procedure, so it needs to be that. Minimally, you want a registered EEG tech. Optimally, the best quality is for the staff to have CLTM. So those are some definite things you want to ask about up front. And if you're an RSP, that's something you want to provide. IT infrastructure is another thing to make sure that you think through thoroughly. As we think about that, your IT department has a tremendous effect on the quality of your monitoring. Very big impact. So you want to make sure that your IT infrastructure within your facility, within your hospital, is able to support your needs. Network speed, all of those types of things need to go into consideration here. But you also want to think about this for your RSP as well. They need to make sure that those remote monitoring have high internet speeds. That will give you quality monitoring. Monitor size is a very important factor. You shouldn't be using laptop monitors to monitor these patients. So all of those types of things need to be going into how you think through this process. You also need to think about line of communication, whether your RSP communicates directly to physicians, to techs, or whoever that is, needs to be thought about for the clinical values and how they're reported. You need to also go ahead and think through developing policies and procedures to standardize your practice for both your staff in your hospital and for the RSPs as well. They need to know what the expectations are. They need to have those provided for them so that they're guided by that, so that you're able to provide all the quality you need. And then you also should be looking for RSPs that will provide quality assurance, and that you can have some very clear quality measures. These should be addressed in your business associate agreement and things of that nature, whatever it is your hospital uses. So those are some of the things you need to think through ahead of time and be ready for whenever you enter into a partnership like this.
Wow, these are great. You've definitely highlighted some of the things that perhaps not a lot of people think about. The screen itself, the monitor itself, the size of it, I think is extremely important. And I know a lot of people will probably be like, well, it's just a laptop. I get to see it. It's not. You're absolutely right. So the fact that you've mentioned that just makes me happy. So these patients will be monitored, through a third party essentially, right? And I would be concerned for privacy. So what are some of the considerations for that, for privacy and security? Uh, what do people really need to think about when it comes to that, and how important really is it?
Yeah,
If
and
no, it's
that's a
important.
great question, definitely. So first of all applications and process used in this must be HIPAA compliant. And this includes everything outside your facility as well, not just your internal IT infrastructure. So if anything cloud-based is used, all those things must be HIPAA compliant. One other thing you need to think about is we think about security and privacy. The monitoring space that is utilized by your remote monitoring technologist also needs to be HIPAA compliant. So all of those things need to be thought through and need to be part of your business associate or your agreement. There should be encryption software that's utilized. So basically, the way to think about this is that everything required of the hospital should also be required of the RSP.
Makes sense. Absolutely. Um, wow, this is a lot of information. This is a lot of fantastic information, Trey. Um, and perhaps my last question would be, what are, monitoring protocols, and why are they important? Are they different from, hospital setting versus remote setting? I feel like a lot of people would be like, well, I can just do whatever I'm doing now, but maybe not, right? So how would we know? What are some of those protocols, some monitoring protocols?
Yeah, another great question. This is definitely something you also want to think about up front as well. So they should be very similar to your site-specific protocols, but you need to address some additional things that would be specific for a remote monitoring technologist. For instance, you need to have explicitly stated what they do, who they call for line of communication. These types of things need to be definitely put into policies and procedures, handoff of care, how they are to respond to different types of events. That needs to be very detailed in what they're supposed to respond to, and how they are supposed to communicate those things, especially in a rapid response situation. You also want to make sure you clearly define roles and responsibilities, not only in your agreement, but also as a standard to guide everyone involved in what their part in all of this is. And then troubleshooting again, it's great to have that put in a protocol as well of what they're supposed to do, what they're supposed to check. And this will help identify any issues. And hopefully, if it's infrastructure for IT or outside, those things can be quickly identified and hopefully resolved, so that there's not any delay in patient care.
That's fantastic. Absolutely. And it would make the tech feel, a lot more confident knowing that these are the guidelines that they're following, and it's all right there for them to see. Um, Really, that's all I had. Thank you, Trey, so much. I think this will be extremely helpful. And you can find this position statement at asset.org and look for best practices. And really, truly, I appreciate you taking the time to have this little chat with me so I can understand it better, which in turn will probably clear up some things for some of our viewers. Really, thank you all, and you have a great rest of your week.
Thanks.
Bye bye.
Bye.